Assalamu alaikum warahmatullah. Now the history nocturnal enuresis. So first of all, what could be the cause if the child is 7 years old? So the cause may be UTI, diabetes mellitus, diabetes insipidus, any psychological effect, any neurological cause, following constipation, and CKD, obstructive sleep apnea, and family. So, just like other history, you can follow that nephrotic syndrome AGM. The history pattern is same, and then his analysis of the presenting complaint. So, when you notice this, does Arif dry at night or control himself at night? Or it is that from the very beginning, that means we are trying to differentiate either it is primary or secondary enuresis. Okay, so how many does he wake up from sleep following this bed waiting, and how many time he has to wake up from sleep? And please don't mind, does did he ever get punished for this? And what about his pee pattern at the daytime? How frequently he pass pee? Do you notice any kind of holding of activity of the pee? And did he ever complain of any kind of pain during the maturation? And did you any event occur following this nighttime bed waiting occurs? And do you have any concern regarding his urine flow? And after that, the constitutional symptoms: fever, weight loss, daily. And systemic review. Systemic review is CNS. Is there any weakness in any part of the body? Is there any defect of the back? And after that, CNS, GIT, any tummy pain. How about his poo? How frequently he pass it? And what who as he's 7 years, probably he can wash himself. Otherwise, if it's a 4 years child, so who wash him after the pee and poo? And does anyone measure his blood pressure? And does she snore at night? And do you have any what's about his thirst? And how frequently he passed it? He take fluid, and what the amount of the fluid at the daytime, at the night time, and what is the kind of this fluid especially at the night time? And can you tell about his dietary pattern? And after this, do you notice any kind of swelling of the leg? And then after the systemic review, then the past illness, just we can follow the pattern of AGN or nephrotic syndrome that I have discussed earlier, and then perinatal history, and then the developmental history, and then family history. The history of diabetes mellitus, bed waiting, and any renal problem in the family. And social history after the income, any change in the recent in life, any family issue arises. What about the sleep hygiene? Is there any easy access to go to toilet? And then schooling, school performance, bullying of this issue, and does he use school toilet when needed? And then presentation. And so we have already, before the starting of this discussion, so differential diagnosis may be following UTI, diabetes mellitus, diabetes insipidus, psychological, neurological cause, constipation, uh, and it may be a case of CKD. So and maybe familial. And so on examination, vital sign, special emphasis on the blood pressure, per abdomen examination, neurological examination, and investigation. First time investigation will be, so investigation, first step investigation, full blood count, urine RCS, and random blood sugar, hemoglobin A1C. Second line investigation, abdominal ultrasonography, spinal X-ray, MRI. And management. First management is a non-pharmacological management. If the child is more than 5 years, so excess food intake, toileting pattern, use the reward system, educate fluid and toilet training at the daytime, and decrease caffeinated fluid, and reward system, alarm system. If it's fail and the child is more than 7 years, so just replace it for 3 months. And if there is nocturnal enuresis or daytime enuresis, or the child is going to any kind of trip, school trip, so summer vacation, so we can suggest oxybutylene. And in case of less than 5 years, reassurance is a common problem. Toilet training, if the child wake up, ask him to go to toilet. And treatment of constipation, if any. Indication for intervention: this is frequent bed waiting, familial problem to cook it, and daytime symptoms, secondary waiting, and child with physical and learning disabilities.